fundamental to all of this is the legal process, and that is the Myanmar military, the Myanmar government to this day haven't been held accountable in the eyes of the law for their actions that started this exodus in the first place. And that is something that the international community needs to be pushing for continuously as well.
Thank you so much, Shamim. Yeah, sadly to know that it's a 500,000 women in need. Like I can imagine that there is a scarcity of wash facilities over there. Hopefully we will look forward, and my next question to you is also related to the legal process in the eyes of law. So I will come back to you later. Thank you so much for highlighting the issues of manifesting and the self-harm and the ways forward, especially the COVID-19 vaccine access. That's the other issue I can imagine. Hopefully we will put some recommendations for this as well later. So I will go directly now to Mr. Faiz Rahman Saab. Sir, I have a question to you that while staying in the United States, being one of the superpower in the world, how do people over there scrutinize gender equality on terms of socioeconomic and political levels? And what are the societal programs in US that are implemented ahead, which can support and create awareness, especially in South Asia region and Africa? And what is the most important thing on gender equality that can be helpful and used right now for the other countries of the world?
Thank you very much, Zara. First of all, good morning to everybody here on the panel, as well as the listeners, the watchers around the world. I don't see them on the screen, but of course, I'm sure there are many. It's still early in the morning here in DC, so I may still be under the influence, so to speak, some water and some juices, but I hope I'll be fine. So first of all, let me thank you, for arranging this. This is an important topic and something that very scant attention has been paid to in our region, meaning back home, I'm talking about South Asia. And as you rightly lamented the fact, Zara, that there aren't data available on this subject, especially in Pakistan. Luckily, in America, of course, being a much more technologically advanced and sophisticated country, they have done quite a bit of research here. And this is, of course, it comes with no surprise that whatever happens, whether it's a natural disaster, it's a pandemic or epidemic, the worst hit areas of always the most disadvantaged, and among them are the women. Unfortunately, America is still, we can't say that it's yes, the ratio may be a little less, the number of women affectees, but at the same time, there are some marked differences. And if you allow me, first of all, let me just add, what's the duration of this webinar? Any idea?
It's an hour. It will continue for an hour.
Okay.
Yeah.
Okay. So if I don't know if I have the capability to
yeah, sure,
share my screen here. Can I?
Yes. Omer, can?
Probably not.
Yeah.
Right. I just want to show you a study from USC, and you can see it for yourself. I don't see the sharing of a screen.
I think so. You can
here.
Let.
Okay, here, right here. Okay, I got it. Green. Okay. So, I mean, you can see it for yourself. Okay, I don't know what's going on, but that's okay. Do you see my screen?
No.
No?
Let me ask. Omer, can we see the screen? Mr. Faiz Rahman want to share his.
desktop. Share, Zoom to share your screen, yes. Okay, well, okay, so let me just, since in the interest of time, I'll just basically, so what's going on here in America, for example, a lot of people lost their jobs during this pandemic, and overall loss was about, let's say, 15 to 16%, and 13% of the total losses were of women, and their male counterparts actually were only 10%. So even though, I mean, of course, it's a much more established society. Yes, the difference is not that much, only 3%, but women were most hard hit in terms of losing their jobs in this pandemic, and they're still losing their jobs. And among those who lost their jobs, their work and their livelihood, non-college educated, the women who didn't have college education, they were the worst sufferers. And then, of course, and women with college degrees fared a little better, but they were still high. Their losses were still higher than their male counterparts. And there's another very interesting argument, or actually a number here, statistics, which is what happens when the schools were closed, and the care for the kids, which gender was actually responsible for the primary responsibility for providing care to their kids. So 33% of women, as opposed to their male counterparts, 11%. We're talking about American households. So they both were either staying home, working from home, or lost their jobs, but still the primary responsibility of taking care of their kids fell upon women. So that's also, one of the indicators of the inequality in genders, of the impact. Another factor here, another very interesting element, that people who reduced their hours at any point since March 2020, I mean, when actually in America, that's when the actual pandemic started. Women with no college were like 57% of the total influenced number of people who had to reduce their working hours, as opposed to their male counterparts, 43%. So I can basically go on and on, but I would just I think there's another very important about the psychological distress. Who suffered the most psychological distress during this pandemic, and still are? Female with kids, 49%. Females without kids, 40%. Their male counterparts, only 33% with kids, and 29% without kids. So even if here you see like 28% male without kids versus 40% females without kids. Even the kids didn't matter here. They suffered the most psychological distress, and still are in this pandemic. So these were some of the numbers, staggering numbers, Zara, that Americans, despite being an advanced and there are like so many nonprofits available for to offer help to especially women, and women have better voices in the media. They're much more educated than a lot of women in in other countries, especially South Asia, but still the impact on them was daunting, was much more pronounced.
Yeah, so I want to ask something very short over here, that I got that there is a like staggering and the terrific percentage of the women who is affected. Okay, but still there is a lack of implementation of the societal programs in America.
Okay, so I mean, this is again very subjective. I don't have an accurate data per se, but from my experience, what I can tell you and your audience is, when I have worked with a lot of undocumented people here, those who live here without proper citizenship papers, especially also in our community as well, Pakistani American community, Muslim American community. But most of these people, they come from Latin America, Mexico. So you see the impact of lack of services to women. They were probably the most hard hit. The survey that I quoted here from the University of Southern California, Zara, was basically based on interviews with people of basically from the mainstream, who do have all the papers, they're proper citizens, they're not living underground. The worst sufferers were and still are the women of color and women without access to government programs because the lack of papers.
Yeah, okay. So you mean that there is a discrimination and there is racism is going over there still in America to implement the societal programs. So I think so. Do you think so that the South Asia region and the Southeast Asia region, Africa and the United States are on the same path?
Well, I wouldn't go that far. I wouldn't really go that far, and that would be an unfair characterization of the American society. Yes, America has come, has done some good stuff when it comes to gender equality. I mean, you see, vice all the way people, of power. She is. We have a female vice president here. So, but yes, of course, it's still, I mean, there are some things which are built in our, overall psychological dispensation, so to speak. You see, women are still discriminated based on gender. You still see domestic violence. So, but I wouldn't really put American society at par with some of our back home societies, and I'm saying this for a reason, Zara. This is for a reason. This is not a political statement, please, because I don't want to sit on our laurels just because okay, so America is also we see all these trends in America as well, so we're doing a good job because we're still a underdeveloped country. We are still developing. No, I mean, we have to do a lot more than probably some other regions in the world, and this is never a kind of a very uniform situation across the world. This point we have to drive this point home, that Pakistan, India, and other countries in the region, they have to do a lot more to make sure that women are properly, they're properly offered those social services that they so badly need in terms of in times of these disasters, these natural disasters.
Yeah, thank you, Faith. A good conclusion in the end, and I think so to deliver it, these important points, we need a research and reporting. So when I talk about the research and the reporting, definitely I would go to Adeshwa Josh to ask my next question. Adeshwa, I have seen the research and the reporting of the effects of the COVID-19 on the African region. That indicates that there is a inequitable gender practices negatively impacted women in the general economy, the workplace, and the home. I heard that the people are talking about it to implement some gender responsive budgeting for women and girls. But so my question to you is that how would you differentiate between fact-based news and fake-based news to address the socio-economic impact of COVID-19 on women and girls? And it would be great that if you outline and suggest some measures to accompany both the immediate response and longer-term recovery efforts in Africa.
Hi, everyone. Thank you so much. I'm so delighted to be here. My name is Adeshowa Josh, as I've been rightly introduced. I think by now we all agree that natural disasters, not just this pandemic, they are not gender neutral for many reasons. They have differential impacts on women and men. So I've decided to coin a word for the effect they have on women as she-impact and the effect they have on men as impact. And I know it sounds very corny, but it helps every one of us remember that when natural disasters, wars, et cetera, happens, it's not just happening to the human race, it's happening differently to men and women, and our experiences at the end of the day are different. So the answer to your question is data and research. And I was very happy with your opening statement when you said you attended a migration refugee conference and you asked them point blank, do you have data? Do you have you been collecting data? And they couldn't give you a definitive answer. Data is synonymous to voodoo. I just want to bring this point home. It's like, it just shows you what's about to happen. It takes you back to history and then predicts the future. And not having data and proper research is like walking blind. And many governments in the world are walking blind, especially on my continent, Africa. Currently, I do a show called Africa Matters, and I have poured like all of my career reporting on that continent. And I know I don't know if I will ever do justice in my lifetime reporting 53 countries, but I try my best. See, data and research, these are two resources that serious governments and stakeholders ideally rely on when formulating policies. I don't see why it should be any different from addressing the social economic impact of COVID-19. One of the reasons why many African governments seem very disconnected in their national policy is basically because they're not tailored at addressing social economic problems of their society. They lack the discipline to collect data or even the political will to invest in it in long term. Or let's just say we'll start with digitizing existing data. Oral history is a big deal in Africa. And I know that we're not going to be like the Western world tomorrow, but I think it's going to be very beneficial in the long run to start from what we have. You said something about fake news and distorted news, etc. You see, news and stories about people suffering in times like this are at best exaggerated. Dare I say, they're hardly fake. Why should they be in the first place? So I wouldn't worry whether a mother lied about losing her pregnancy because a lockdown policy, which couldn't imagine women in their third trimester, will need an ambulance station in their communities for when their water broke or when it is time to deliver, okay? Or whether she lied about that or what actually killed her was because of natural causes or underlying health factors, which brings me to the point, when people talk about their miseries in a situation like this, it's usually probably not fake, exaggerated at best, probably not fake. So governments are generally better prepared to respond to natural disasters when they have data they can rely on or improve on. So when there is a natural disaster, the first thing to be done is look at your data. Where are the weak points? And begin to redirect resources towards them. News and stories sometimes get it wrong, but they're usually within the vicinity of truth, and numbers never lie. Numbers never lie. These are my suggested measures to accompany both the immediate response and longer-term recovery effects. Against the background of the fact that 74% of women in Africa, 74, let that sink in. I do personally, as a matter of personal principle, I try not to represent people with statistics because it just takes away the ability to imagine that their people, their children, their aunties, their uncles, etc. But for the sake of this webinar, 74% of women in Africa and the whole of that continent, 53 countries, including my mother, my sister-in-law, are engaged in the informal sector, which includes working as street vendors and domestic workers. The informal sector provides livelihood and employment to a majority of the urban poor. Women are also overrepresented in the service, tourism, hospitality sector, a sector characterized by low paid and limited job security. Let that sink in. And that is why when we talk about, oh, this pandemic or natural disasters are affecting women more, some people just make us feel as if we're over buttressing this point. It's not true, because women are usually at the forefront of the lowest paid jobs. We're caregivers, we're the nurses. When you talk about throughout this pandemic, for example, or take a look at the percentage, the statistics of the workers who have been at the front line. They've been women taking care of the sick, you know, giving care to the old ones, et cetera, et cetera. Especially so in Africa. Perhaps in the US, you know, you have a mixture of both men and women. But in my part of the world, it's been women. And that sector is so informal. If anything happens, if there is a disturbance in the balance, the whole resources dries out. These are the economic measures. I'm hoping the policymakers, governments, stakeholders, whoever has money and means to do anything, will consider. Take a gender approach to economic measures. And by that, I mean design it differently for women, preferably by other women. I personally hate is a strong word. I personally dislike when the solutions curated for women are being implemented, discussed, thought, written by men. For example, in this pandemic, when we had lockdowns and all, men weren't menstruating. If there is a lockdown, all the shops were closed. I will be talking about, where am I going to get my sanitary towel? He's not going to be thinking about that. This, I'm just trying to bring my points home. It affects us differently. Set up social security. Set up social security for women. Think about their day-to-day needs and find a way to set up social security. I personally don't like the idea of giving people money because it never lasts. So there are other ways to do it, and I'll explain. Since natural disasters and wars create a unique set of needs, Okay, I'll use war. During war, actually, it makes some people rich, people who make bullets and warplanes and etc. So when we think about natural disasters, wars, blah, 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 crisis, there is an opportunity right there, and we need to zero in. And then what? Rejig the opportunities and redistribute the opportunities. Take away the extra workload on the formal sector and redirect it to the informal sector. And this is what I mean. Instead of outsourcing those needs abroad or increasing the workload of those formal sector, why not incorporate these women into the workforce that addresses the immediate needs of their communities during the pandemic? A very good example is that during the crisis, we needed masks, we needed hand sanitizers and all. Instead of importing them, why not get a soap making company, do a quick skill acquisition program and get all these women, put them back, let them make the masks, let them make the hand sanitizers, et cetera. It's a simple way, it's very fundamental. And some of these, when I think about some of these solutions and some of these quick fixes, and the way I think about them is because of how many years of reporting on the ground and seeing how simple this can be. But it doesn't appear simple because our governments, most of our governments, they're disconnected from their people. That's number one. Then number two, we outsource this basic research and legwork to international aid organizations. I will talk about that another day. So most governments imported them. I say, why not make the women do it and pay them? This is a practical way to ensure job security during crisis. Establish direct measures of compensation and economic empowerment of women. Why they're learning those skills? Okay, then decide, this is the budget we're going to give people back. We're going to say share money, which is a very tricky business. Okay, then if you don't want to share money, then think of the household needs. Maggi, salt, this little things that's going to sustain families just before you go into the next level of social security. there was the issue of rent also. I don't even know how rent is going to, but that's also something that needs to be worked on. Finally, the trick is to think and care about women generally, because that will help governments and stakeholders tailor their policies to their needs. There is no one size fits all. You have to think enough about this, people care enough about them to be able to come up with tailorable measures. Also, there is the healthcare measures, which I mentioned earlier. Let data inform you on where to redirect the resources, because women have ongoing needs, both maternal and reproductive health. Finally, I will suggest incorporating technology into Africa's informal sector for long term. And of course, basic tech training through adult education. As I mentioned earlier, Africa's economy is largely driven by the informal sector, which relies on close human interaction. Because of lockdown measures, these interactions were eradicated and along with the livelihoods. But imagine a scenario where an app allows local farmers and traders deliver their goods to customers without leaving the comfort of their homes. A good example is Getir and Yemek Sepeti here in Istanbul. Thank God for those apps. What I did during the pandemic was just order my food and it came home. And all the local, shops, there's a warehouse, and they were still getting their money, and a little bit of income was coming in. If we think enough about women, if we think enough about people, if we care enough, if we do the legwork, the answers are staring us in the face, because every problem comes with its own answers. As for long term, incorporating technology. Thank you.
Yeah, true. Very true. The number you have shared at your initial answer, that 74% is really a horrible number, and we can compare it with the United States, and now we have data actually right here. So I really like your point about the gender approach for the woman, preferably thought and written by men. Obviously, it should not be.
God bless the men, though.
Yeah.
Some men are very in touch with their feminine side and all, but just it's just easier.
Yes. Unfortunately, I'm now thinking that why I never thought about this like that, and we need to highlight this point on the bigger level, especially over here, and obviously the other countries as well. We really need to set up the social security, and you are very right that it's a natural disaster that says unique needs in terms of affected women and children, or even men. So we are talking about the natural disasters. We have an expert over here in STPI, Dr. Shafkat Munisa. So I would ask him a question, Dr. Shafkat. You have listened, we only need a very fundamental ways to deal with these natural disasters, not like very big resources, and we need to tailor some needs, some basic needs to the affected one. So what do you think, how we can achieve this gender equality and the empowerment of all women and girls that is absolutely correlated in the context of climate change, environmental and disaster risk reduction policies and programs?
Thank you, Zara. First of all, I would like to thank three of our colleagues who just spoke before me. That is one point commonly they have raised is about data. Adeshwar Faiz and Shamim Chaudhary, they talked about it. Let me just quote it, because this is a gender-specific discussion. Let me just recall from my experience of working in Myanmar, Philippines, and other parts of Asia, where I have covered huge emergencies over the last 20 years in my work as a humanitarian policy specialist. Fundamentally, if you look at disaster and pandemic, all pandemics can be disaster, but all disaster cannot be pandemic. So though the impacts are both have the impact, but we cannot actually make it at par with the disaster and pandemic. Both have emergency and humanitarian issue. Why I'm saying this? Because if there is a disaster cannot. Generally, we have seen the disaster which has not affected the whole communities, the whole of world. But pandemic, like COVID, we have seen the whole world was impacted by that. even in emergencies and in conflict, there are other countries and there are humanitarian actors and humanitarian institutions they have been supporting in one country. For example, there was Ebola in Africa. Many of my colleagues went to there and they supported in Ebola. But in case of pandemic which we are facing now, COVID-19, even the service provider, humanitarian staff, they were also affected. The frontline worker, the health worker was impacted. So this had a huge impact. If you look at the situation in COVID situation, we have seen that loss of job, closure of schools, travel bans, movement restriction, and many more, loss of savings in case of the middle income people living in our society. They have been, because they lost jobs, so their income was reduced because they were using their saving for that. Now the impacts of all disasters and pandemics hit everyone, those who are hit by the pandemic or the disaster. But why we say women are largely hit, or women are hit with their specific needs, because women has to play two roles. The one, a woman herself is affected by the pandemic, but in our society, when we look at it, they are the caregivers. So as a caregiver, they have a double trauma. So this is women have to face a double trauma. One, being affected themselves, or if the family members are affected, then as a caregiver, they have to go there. As Faisal told us about some of the data from the American perspective, and I have seen some of the data which Canadians issued. But if the data problem is a fundamental issue here in Global South. Colleague from Africa also mentioned, Shamim from Bangladesh mentioned about it. But in the Global North, data and data segregation, and that too along gender segregation is available. But here in our part, every day data is issued in Pakistan also by our National Command Authority regarding infections. But it is not saying how much percentage of that is of women. Even, my experience of working here, I have seen a lot of women being affected, because even despite the fact that they are just not working outside, but they are just housewives, they are got affected, but because their husbands or their sons or their male members of the family, they come from outside. If they are infected, certainly the COVID has a characteristic which impacts those who are closer to them. And that's why now the fourth wave, particularly in Pakistan, I'm talking about, that's affecting the whole families, elders, middle-aged people, young people. It is impacting now the families. If one person is infected, it is getting whole family impacted. And even then, I have seen families where women has to undergo the double trauma and stress, because they have to provide food to their family member. Even then, if they also have symptoms, they were serving the people in family. So that kind of things particularly are important to know. A recent report on the World Bank report about this issue on how women are impacted, or the gender dimension of COVID. And even previously, I am happy that most of the colleagues here in the panel, they have been part of the humanitarian coverage in their role as a journalist or as community supporters. They have the role and they have played in camps. I have also worked in camps, and what there are. Certainly, I agree with Shivni that there are a lot of challenges in the camps when people are there. And Adeshwa also mentioned about this. So if you look at that way, we are impacted, but women are impacted differently. And similarly, women have a different role. They play their role differently when they are responding to any pandemic. So these both angles should be kept in mind. For example, I would like to quote here one example from Philippines, from the Heian cyclone, when I was there, we were having a field tour looking at what are the specific needs of different people. Because if a disaster or a pandemic hits people, all people, but it impact differently to women and some of the disadvantaged groups, marginalized groups, people living with disabilities. So they have their specific need. Similarly, in the field, I saw that the structure of the houses were broken in Philippines, in one of the Brengayas, which is a small unit of Union Council level. And there were some of the toilet seats were intact. I discussed with my team, and there was a company, Pipu, called Pipu. They were providing tents to various localities. I discussed them, can they provide some of the tent which can hide these toilet seats so that women can use it? Because, you know, the men can go in field, and even in the day, they can go and then they can have this, their column of attention, and then, but women had to wait till dark to go to the toilets. So that immediate needs we focused, and people provided us that tents which we gave to the community, and I had the video. I cannot show you what impression of these women were when I was recording them after providing them this facility. How relaxed and how now they were in trauma, but only with this small women-specific action, they were so happy, and their emotions were only captured in my camera. But I'm telling you, they were feeling like they were given a heaven to them at that time of point in time. So there are other specific needs when we talk about emergency preparedness with the people living with the disabilities, how to evacuate them from any sort of disaster and pandemic. In that way, if you look at some of the people say, why you are talking about especially on women needs, why you talk about gender dimension of pandemic, when pandemic is hitting everyone, they forget that there are certain specific needs which require. Now I would quote here an example from Pakistan. When pandemic hit, we were looking at the immediate relief goods being distributed by some philanthropists and the government institution, and some of individuals, those who were providing aid to the people. Many of the women who could not access this aid coming forward on the street and getting it, and they were sitting back in home, and they were house head of their houses. They were not having this kind of access. So the access was not there to humanitarian assistance. Access was not to the women's specific needs in that kind of emergencies and pandemic. My point is that this is not a luxury that we give support to women. This is the basic needs, and it should be part of the plan. It should be the future preparedness plan, gender specific plan. If we will not be doing that, certainly we will, for new emergency or new pandemic, we will not again repeating the same mistake of leaving women behind. So I will stop here because I guess Zara has some more questions. Thank you very much.
Thank you. It's such an interesting discussion, and I'm afraid that we are already crossed 1 hour. So my next question is to Aisha Silvery. Sir has explained a very good point that we have data segregation, but we don't have the data segregation on the basis of gender segregation. So Aisha, so next question to you. You know that in the lockdown during COVID-19 in Pakistan especially, we know that this is a hard place for women, and it's not only getting harder until we call out misogyny and case after case of violence against women till now in Pakistan especially, and it's highlighted on the international media as well. So how to tackle and cater lack of information and promote awareness to women regarding sexual harassment, violences such as domestic assault, rape, blackmailing and burning of a woman in such patriarchal society like Pakistan?
Thank you so much, Zara, and thank you to SDPI and everybody who spoke here today, quite articulating, a shadow pandemic, which is a pandemic that is on side by side with the COVID pandemic and
Can you please
disproportionately
unmute
affects
yourself?
women. Can I proceed, Sarah?
Yes, please.
Okay.
Yeah.
All right. I think some people haven't muted their mics. So I think what we need to understand when we talk about the shadow pandemic, particularly with related to Pakistan, I wanted to just give a visual example of 3 really bad cases that happened recently. Just this year, we saw something called the Motorway Rape, where a mother was traveling with her young children on the motorway between 2 cities, interstate travel. It was a little late for her to travel. Her car broke down and didn't have petrol. She was gang raped by a bunch of thugs who then made her children watch the episode and then also proceeded to, I think, document it. The worst thing that happened was that the police chief actually victim blamed her. The second event I think that really shook us was a recent murder of Noor Muqaddam, where the person that she was perhaps dating right here in Islamabad, a couple of blocks away from where I am right now, kept her hostage for 2 days and then beheaded her with hedge seers. And even after that, we saw a lot of men from across social media platforms, as well as very educated men, ask the question, what was she doing there in the first place? Again, a lot of victim blaming. The third event that happened was there was a woman celebrating Independence Day in Pakistan, and she was in the middle of a public crowd, and she was recording a TikTok video where 400 men decided to molest her, sexually harass her, rip her clothes away, videotape her, almost killed her. That was a level of violence that she was subjected to. It was like a massive amount of mob violence. Again, lots of victim blaming about what she was doing in a public space. And if a woman is really going to be in a public space, she's fair game. I'm giving these 3 examples to identify the fact that what we're experiencing in Pakistan today is femicide. There is a war on women, and anybody who denies that or tries to cloak it perhaps hasn't looked at the data. So yes, the COVID vaccination data for women is very low. We don't have it completely segregated, but you just have to look at the core headlines and the reaction to those headlines by policymakers to understand how dire it is for women in Pakistan. Before the pandemic, 9 out of 10 women in Pakistan, according to Thomson Reuters, would either face violence or will face violence or have faced violence. Now you can imagine the same women who are part of the caregiving economy, who are stuck at home more than men are stuck at home, who are close to poverty more than men are close to poverty, who are more unwell and more at risk of reproductive challenges. And my colleagues at Sewa and everybody talked about menstrual health, for instance. Now, all of these women completely at risk and completely vulnerable are blocked down by the very men who are supposed to protect them. But the home is, in terms of Pakistani women, the most dangerous place for a woman. So the public space we have seen is very dangerous, as I identified with this woman who was harassed by 400 men, and everybody partook in it and did not save her. So the public space is not safe. Secondly, the home is not safe. So the woman who was with her significant partner who beheaded her, she wasn't safe either. And you're not safe on the interstate as well when you're traveling. And for women to be empowered, we understand mobility, a sense of peace in the house, access to finance, and the ability to not be killed, I think is a very fundamental prerequisite to empowerment. So while we are discussing the pandemic and while we're talking about how many women are vaccinated, I think it's important to understand that women had war waged on them before the pandemic came. And now the pandemic has made absolute impunity for that war to destroy women utterly and completely. And some might think that I'm being extreme here, but just a couple of statistics. In Pakistan, we have only 20% of women who work with the formal sector. In Pakistan, only 2.5% of women own an asset like a property. In Pakistan, only 30% of women have access to finance like a bank account or a mobile banking account. In Pakistan, 40% of women who experience sexual harassment or rape or violence, or even within their homes, a lot of abuse from their partners or from their fathers or brothers or are honor killed, do not report the violence. So what we're seeing is absolute, I think, dire situation where none of these reforms that we're talking about will come to play if there's violence. In the absence of violence is the only time we're going to see any of these programmatic development programs working. And Advesa brought up some really interesting point about using local economy to fuel it. But what I see here in Pakistan is sometimes that the aid economy is almost part of the war profiteering economy, where you then just bring these external ideas on how to save a local population. And half of those programs are extremely exclusivist in their design. They leave women out of the representation. They leave intersectional women out of the representation. If they want women, they're looking at elite women. They're not looking at poor women. They're not looking at certain ethnic minority communities. And there's exclusion all the way, even within the programs recommended. Having said that, I obviously don't want to leave a dire situation out there. I want to make a couple of recommendations. I think the first recommendation is that obviously put girls and adolescent girls at the center of all your programming. Second, focus on Afghanistan. The Pakistan-Afghanistan border right now is teeming with refugee women who are giving birth. During their migrant travel patterns, we see an estimate of 1.5 million to perhaps 3 million who are displaced internally and on the Pakistan border. They do not have access to wash facilities. They do not have access to menstrual hygiene facilities. They do not have access to emergency healthcare. They don't even have food security. So if anybody is looking at this region, I think we cannot tear our eyes away from what's happening there. Third, you have to work with pre-existing programs. If something's already existing within the social security network of your country, use that rather than recreate the wheel and restart programs and have high admin costs. Four, please use mobile cash transfers. When a woman is in charge of her own money, she's likely to use it to save herself from the violence. She's likely to use it to give it towards health and education. And she's likely to use it to improve her status. And a mobile phone, even if it's not a smartphone, can be fantastic in that regard in terms of protecting her. Lastly, low transfer costs. So there's so many programs that do a lot of high transfer costs. Like, for example, a lot of governments can just reduce the bills of the households that are under economic deprivation. And lastly, I think while we help and assist, it is very important to look at local communities in terms of what they need, whether what you're giving them is what they need at all or not. So they have to be part of the policy making, and representation matters a lot. I think I'll end there. In summary, I'll just like to say, women do about 3 times to 4 times more of the unpaid work in the economy. And in Pakistan, women are just considered to be an extra leg of the care economy without any compensation, without any status, and that needs to absolutely change. And the second thing is we need to end the violence against women, and we need to do our part in it. And we can start that by recognizing that there's a war on women in Pakistan, and let's not make excuses for that. I think that's a good place to start.
Thank you, Aisha. A very nice discussion of the points and the recommendations. You are right that COVID-19 is femicide, and when you were mentioning about the situations we suffered over here in Pakistan, I can realize that what type of trauma we suffered and how scared we are now. You are right, we really need digitization, which Ms. Andeshwa George also mentioned about the data digitization. But you are right, we should promote the use mobile cash transfer, as I visited the vulnerable parts of the Pakistan, and that's the more demanding issue over here right now. So without any further ado, I would go to Ms. Shamim. We have already time short. Shamim, like I want to ask you that you talk about the legislations, rules and regulations. So how we can become successful and when we apply international gender lens to the design of fiscal stimulus packages and social assistance programs?
A grassroots level. I mean, you will find, for example, in India, the caste ban is illegal. The caste system is illegal, but you will find that it is commonplace attitudes. If you go into more rural areas, if you move away from urban areas, that these long-standing attitudes towards the caste system prevail and manifest themselves in apart from anything else, in gender inequality. So that this is just a kind of very basic example of the limitations of legislation. I mean, in terms of I think governments need to work in conjunction with aid agencies and with media organizations and other interested bodies in order to kind of deal with the challenges faced as a result of the COVID-19 pandemic, and in particular gender-related issues. But I have to reiterate here, though, that I really believe, and I think this is a point that has been made by all the other panelists, most recently Aisha, is that the COVID-19 pandemic is just one element of the disadvantages and the discrimination faced by women in South Asia and beyond. And we really need to remember that it is one part of the jigsaw. You know, there are many other kind of socioeconomic factors that women have had to deal with, you know, for time untold now, for decades. So I think, you know, we need to, of course, the pandemic has brought with it its own specific challenges that need to be addressed, and that broadly is the short-term and long-term health implications and the short-term and long-term economic implications specifically for women. But I don't think I don't think it's helpful. I don't think it will make us move forward if we kind of separate the challenges faced as a result of the COVID-19 pandemic from the other issues, such as gender-related violence and economic disadvantages that women have been facing, and the fact that the challenges that come with being care workers that they have been facing, you know, since the beginning of time. So that I think we do need to kind of bear that in mind. In terms of just going back to your question, then obviously governments have to have to make more of a concerted effort. They need to be more transparent. They need to be more they need to be held accountable for any decisions that they make. If they are not making decisions, then there needs to be public pressure on this. This is a basic fundamental characteristic of any democracy. So we need to hear unrepressed and voices from the nations, the citizens of the countries that the governments are reporting. They need to be able to do this without fear and without intimidation and without the risk of being arrested or accusations of sedition or whatever it is that we often see around the world, in some parts of the world to a greater extent than others. And we need to see governments and charity workers and individuals, men and women, working together. We need to keep the dialogue, we need to keep the narrative and the dialogue in the public space. We need to make sure that it's the discussion doesn't go away, that it doesn't peter away, that it doesn't fade away, and we need to work for long-term solutions. I mean, I'm giving you a very broad response here, and I think in the context of this discussion and our time limitations, it can really be quite broad, and I'm kind of touching on things that we all know, but I really believe that they do need to be reiterated. I'll just make a very, very, very quick point here, because I know time is running out, but in terms of the Bangladeshi government and the Rohingya, and the reason why I go back to the Rohingya is simply because, you know, I have first-hand experience of it and I've covered it. It's certainly the points that I'm making are certainly not exclusionary. They certainly do not apply just to the Rohingya, but there are of course specific factors, specific characteristics of women in Rohingya refugee camps. And I would say this: the Bangladeshi government has been credited, and rightly so, for allowing more than 1 million Rohingya refugees to reside in its camps indefinitely, but it needs to do more in terms of providing the funding and the awareness to make sure that some of the challenges that the Rohingya are facing are tackled head on. Now, Bangladesh has been credited for empowering women, in particular compared to other South Asian countries, Pakistan and Bangladesh. Garments workers, it's 82% of Bangladesh's export. Something like 90% of all garments workers are women. They have become economically empowered. They have lifted their families out of poverty. They have put their children through schools. They've built houses. They symbolize the empowerment that we can see in Bangladeshi women. According to the World Bank, the GDP per capita in Bangladesh is higher than in Pakistan and in India, and this is something to be commended. But there is a lot of work to be done. We can't just stop there. Bangladesh still faces many problems, and all of these need to be tackled not just on a governmental level, but on a civic level as well. And again, I say this is all very broad brushing, but I think there are some very important points there that do need to be highlighted.
Yeah, you're pretty right that we need to solve our problems at the civic level, and it's not the government, and we need to be more transparent and accountable. At least that is the basic fundamental of democracy. So I would go to Ms. Adeshwa Josh for the next question. How the journalism promoting gender equality, and do you think is it applicable or not, or how to anticipate a closer look at the contemporary gender conflicts in the context of reducing capacity to absorb economic shocks and the reduced access to social protection? So you have 3 to 4 minutes. Sorry. Your mic is mute.
Yeah. This has been a very interesting webinar, to be honest with you. I'm only going to go back to my earlier point, one of my earlier points, and then I'll make the last one. I say, let's go back to data. Remember I said without data, it's like we're walking blind. And to put it in local parlance where I'm from, data is like voodoo. You go to a herbalist and you say, I want to know my future. That's what data does for you. It helps you to understand the trends, what might break, what might be quote unquote, a breaking story. You foresee things when you have data. To anticipate it, just collect. And sometimes we might have to collect for 10 years and nothing in particular will come of it, but we have it anyway. So let's collect data and let's attempt to digitize it, because that way we'll save it forever. Except of course the big tech decide to confiscate the data, but it does and it will exist. The second thing, which is pretty controversial, there's a lot of anecdote here because I've been thinking largely about it. You see, from my end of the world, before colonialism, women weren't unempowered. They were everything in most cases. They were not as repressed as we talk about it now. We had women warriors, women who defended a whole colony, women fighters, women warriors, farmers who kept their homes. Women were just not synonymous to oppression. But when we entered into the colonial era, they came with these customary laws that sort of relegated the women, and the men were put into the workforce. And of course, because of that, all kinds of wages were set and all. So men became the custodians of the home. Before that time, you do your thing, the woman does her thing. You can choose to want to marry and be a housewife. In most cases, this is a part of history that Black people don't talk about a lot, but I think we need to talk about it. And so those customary laws sort of changed. And so women became more like, oh, let's make babies and let's take care of the home, and the man will go out and all of that. And so there was a certain minimum wage. And in other parts of the world, there were all kinds of, I wouldn't call it revolution, but, you know, progress, whatever was going on in the society. But in the West in the 30s and 1930s and all, women started going back to the workforce, et cetera, et cetera. And now also in parts of Africa, women are stepping up socially and economically. My point is, while all of those changes were happening and women came back into the workforce, what simply happened was just, in my opinion, the wages were halved. You know, so men weren't making as much. Some men weren't. Some men are making more. And I wish I have the data to back this up. Like I said, a lot of it is anecdotal. And so it's like the wages, so women are back in the workforce. If men used to earn 30,000 rupees, you know, the employer's like, okay, so we have more people in the workforce now, take 10 rupees. We're taking out of the men's wages and giving it to the men. At the end of the day, I do not think that with all of the revolution, for the middle class at the very least, the wages has gone up the way it should. So it's like men are back in the workforce. It's like now you need two hands to work to be able to sustain a family. Back in the day, quote unquote, it used to be one man is working and they were sustaining the family. And there are other factors, inflation, blah, blah, blah. You can talk about it. Bottom line, let's not blame the women coming back into the workforce. I think we should press policymakers, government, to raise the minimum wage, to take into account the expanded workforce, to breaking it down and using colloquial language now, to not make the boys hate me for coming back to work, for, you know, for joining the workforce, like, and then like, because of you, I'm earning less now, and they're giving me just, you know, just raking out of their salaries and giving to me. Policymakers, you know, like they need to raise substantially the minimum wage. And I've been reading about how to do that. Economists know how to do it. It needs to reflect the current day needs of our society. We cannot be working this hard and still be earning as if, you know what I mean? If we do that and women have more money in their pockets, they can support their husbands, their partners, their children, okay? So that if one source of income disappears, the other person is not lame and is not feeling helpless to support. You see what I mean? And I don't know how else to represent this. I know I've blabbered around it, but the bottom line is we've got to raise the minimum wage. It used to be okay when one person would work and support the rest of the family. Now, everybody's got to work to support the family. And now, even worse, when one means of income is blocked out, the family goes into, it erupts basically. It's just because we're working so hard, and at least for the middle class, there's just not enough to cater for, you know. It's so simple. There's inflation, price inflation is gone up. One of the things is gone up during this pandemic is the price of food and everything. Has your salary increased? No. So we're spending more. Are you making more? That's my point. Let's go back to data. Raise minimum wage.
Yeah, I think so. All the problem starts from here. Women need more money in pockets. You know what I mean? So I think so. It's very difficult for man to handle this. I want to discuss other points, but as we have shortage of time, you highlighted very like gentle points on this agenda. Aisha, are you there? I think so. Okay, if she's not here, then I think so. We should go towards the conclusion. Thank you very much for taking the time to speak to us today on the very important topic of gender dimensions in the times of COVID-19 pandemic. Thank you so much, Ms. Shamim Chaudhary and Deshwar Josh, Faz Rahman, Dr. Shafqat Munir Saab, and Ms. Aisha Savary. Like if I conclude like my session over here, the points you share with us about the you know, the policymakers and the suspended workforce and the, you know, wages, I would conclude on like this, like gender equality is not only a human rights issue, but also a precondition for achieving wider foreign development policy objectives. Do you want to say any one line or something to conclude this with my objective? One word? Any, Adeshwa?
Yeah. It's just, again, data, and please raise the minimum wage.
Okay, yeah.
Make it reflect the development in the increases we're seeing in the society. Inflation goes faster, higher. Yeah. It's just rising. In my country, it's a double digits, and it doesn't mean the salaries have increased. So people are spending more than they're earning. How do you live like that? And sources of income is shutting down, livelihoods are being eradicated every day. So we've got to balance this, macro and micro economy. I'm not an economist, but they have all those words they use to represent a basic. What they're simply trying to say is I shouldn't be earning less than I spend, and it's not because I'm spending too much. So, and there are people who are more at the receiving end of this than I would still say I'm lucky.
Yeah, thank you so much, Ms. Shamin.
In summary, I would say it would be a collaboration between governments, greater government accountability and transparency, a more concerted and sustained international global effort encompassing media organizations, NGOs, and humanitarian aid organizations, all working together and to maintain the these awareness in the public, wider public consciousness, and I think this is really the very basics in the way forward.
Oh yeah, thank you so much. Once again, on behalf of the SDP, I thank you all, and I thank you for what you do for others in our community. Like, it's bravo, great. I was just thinking that I have wrote 7 articles and it's enough, and I've visited the other vulnerable fields in my country. But when I see you girls, so it's for me a wake-up call, and it's a time that I know I have to go, a long road is waited for me. I have to do more and more and more. So more power to you, girls and men also. So see you somewhere next time on some other platform. So Hamba Kashle, Tata, goodbye, Allah Hafiz. I think so, I'm right, Dosh.